Leptospirosis is a disease caused by a bacteria known as Leptospira, and it's found worldwide in soil and water, mainly in areas with a lot of rainfall, but it is found everywhere. Dogs pick up leptospirosis through contamination with infected water and soil. Wildlife carry lepto. Skunks, rats, raccoons, deer, any kind of wildlife. If an infected animal is even in your backyard and urinates in puddles, urinates in the grass, urinates in the soil, and the dog goes outside, they can pick it up through either their mucous membranes in their mouth or cuts on their feet, cuts on their bodies, anything where the water can seep in or the soil, bacteria from the soil can enter their body. It can be found in, if your dog plays in creeks, in ponds, goes swimming, it can be found there, but it can be also found just in the backyard. So even city dogs, we're actually seeing a huge increase in the number of city animals that we see with leptospirosis. There is a very large raccoon and rat population now in cities, and those are the culprits at this point in time. And there is no dog. If your dog goes outside at all, they are at risk for this disease. They're pretty nonspecific. Your dog just is going to seem sick. They're going to be lethargic. There's going to be loss of appetite. They're not going to want to move. They're going to be achy. A lot of times you'll see vomiting and diarrhea. Sometimes you'll see increased thirst, increased urination. In more severe cases, you'll see jaundice of the skin and eyes. So the diagnosis is going to require a lot of testing. There's specific blood tests for leptospirosis, but those take a few days. So in the meantime, we have to run basic blood work, oftentimes take x-rays, do an ultrasound in order to get confirm our suspicions that it is leptospirosis until we get the actual test, blood test specifically for it back. The sooner you treat, the better. It is treatable if it's found very early and treated very aggressively. Most of the dogs that we have seen lately, we catch too late and we have not been able to save. We've had probably 5 cases in the last few months that we were not able to save because we caught them too late. If they are found in the very early courses of the disease, when you think there's just something not right, then we can treat them and then we can save them. Often, however, even those dogs that we do treat, they are left with permanent kidney and liver damage. Absolutely, there's a very easy way to stop it. There is a very safe and effective vaccination, annual vaccination that covers several strains of leptospirosis. All of the strains that we see in this area are covered by the vaccination. And it's an annual vaccine. It's not any more expensive than any other routine vaccine. Here at Ellicott Small Animal Hospital, it is a core vaccine now, so and has been for many, many years. So it's very easily prevented. Humans can get leptospirosis. Now, most of the time we get it from contaminated places where we swim, but we can get it from our own animals. And it can cause pretty severe illness in humans as well. So it's not something that if we can prevent it in dogs and prevent it from spreading to the human population, that's as veterinarians, that's something very important to us.